Hi, I'm Jason Bellamy, coming to you from Next 2017 in Boston, Massachusetts, and I'm joined by a woman who needs no introduction, Marilyn Moffat. Marilyn, thanks for doing this.
My pleasure.
So we're going to talk about the Fellows Forum, and before we talk about the Fellows Forum, let's talk about who the Fellows are. The Catherine Worthingham Fellows, it's the highest honor that APTA gives. Over the years, 218 people, including people this year, have been recognized as Catherine Worthingham Fellows. You are one of those individuals. So first of all, tell me how this Fellows Forum works.
Well, it started several years ago when we began to realize that there was a need for the membership to realize the amazing background that the Fellows brought to this association, and to also begin to vet and to look at issues that maybe members had not thought about. So the forum tomorrow is an evolution of the early activities.
So right, so the event is tomorrow. It's from 1 to 2:30 here in Boston for people who are here and can attend that. Tell me who the other panelists are.
Okay, I start as the lead-off, and I'll be talking about the content in a few seconds.
Right.
But Dr. Julie Fritz will be a panel participant as well, and she'll be talking about the physical therapist's activities and views and roles in population health. Then we have Dr. Lisa Saladin, who is on the board of directors of APTA, and she'll be talking about global and professional issues, particularly as they relate to the non-communicable diseases. And then Dr. Gail Jensen will take the next part, and she'll be looking at physical therapist's role in societal issues. And then Dr. Karen Pascal will be finishing up with looking at education as it pertains to the role of physical therapists in societal issues.
So you mentioned the topic there, non-communicable diseases. You always take on a societal issue. Why that issue? Why now?
Right. Well, you know, the association has taken on as its vision transforming society. And we as physical therapists have to think about how we really can have a major impact on transforming society. And if we look across the country and look around the world, we know that the major causes of disease and disability, and particularly mortality, are the non-communicable diseases. In the U.S., we're looking at cardiovascular disease, we're looking at chronic obstructive pulmonary disease, we're looking at some forms of cancer, and we're looking at diabetes as the leading causes of mortality in this country. And then you have their associated risk factors as well, and here we have a huge role to play, because if you look at the basic risk factors of tobacco and alcohol and elevated blood sugar and elevated blood pressure and elevated cholesterol, we know that exercise certainly has an impact on these. But then we have unhealthy diet, and a big, big factor is the physical inactivity. And that's where we as physical therapists must assume our role. So if we get a patient in our practice who comes in having a problem with a knee, whether it's a total knee replacement or whether it's bursitis of the hip, and we recognize that they're pre-diabetic, or they may have some pre-existing or some family risk factors related to cardiovascular disease, we have to begin to think about addressing those and making sure that that patient is not only a joint or a part of a body that we treat, but looking at the whole entity.
So doing that, you just put your finger on the problem. Is that change just a mind shift change? In other words, do physical therapists have all the tools they need to do that, or are there other changes that need to be made to allow that to happen?
No, with our education as it is at the doctoral level, we should have the background to be able to handle those. I just think traditionally our application of our interventions has often been focused on a single entity, as opposed to, again, looking at that whole person and their societal roles and what the disease entity may mean in terms of the societal impact.
So in terms of people who attend this forum, I mean, I don't want you to speak for the other panelists because you're supposed to be moderating, but I mean, what do you think some of the aha moments will be for physical therapists and PTAs and students who are in the audience tomorrow listening about this?
Well, I think first and foremost, when they look at the demographics related to the NCDs, I mean, to me, when I started teaching around the country and around the world about NCDs, it was an aha moment to me. I mean, we're not talking about a small problem. We're talking about a huge problem, not only in terms of numbers, but the economic costs are just astronomical. So that certainly is, I think, mind-boggling. Then we've got to look at the whole factor of behavioral aspect of managing disease entity or managing disabilities or other facets that maybe we have not done as much as we need to do now.
So, you're a past president of WCBT. Right. So when you're talking about NCDs, Is this a U.S. problem? Is this a world problem? Or is it that there are certain NCDs that sort of are typically a U.S. problem, but maybe not elsewhere?
No.
What's the world landscape?
It's fascinating because the NCDs are around the world, and the incidence is almost the same. I mean, there are some countries, obviously, where it's 88% of mortality or 92% of mortality, and there are other countries where it may be 60% of mortality. But even in places like sub-Saharan Africa, where the disease entities used to be the biggest leaders to mortality, now the NCDs have taken over as the leading cause of mortality.
And do we know the reason behind that shift? I mean,
well, it's, society has changed. Right. We don't eat as well as we used to eat. We don't exercise as much as we used to exercise. I mean, people walked and were out in the fields and doing all sorts of things, and now we get in cars. And if you look at the vegetable and fruit consumption in the United States, I think there are 4 states in the entire union where they get adequate amounts of fruits and vegetables. So right. It's a whole arrangement of things that have led to these, what they now call non-communicable diseases. I might just point out, when they first were sort of looked at by WHO and our government, they were called the lifestyle-related diseases or the diseases of civilization. Neither of those are probably too politically correct, but it gave you an indication that generally, the higher the income of the country, the greater those diseases were found, and then we see it now just around the world.
So you talked about a few different kinds of shifts. One shift is the shift from basically physical therapists looking at a person who comes in their clinic who has a specific problem and basically only looking at that problem. That's one shift. The focus on physical activity is something that this profession more and more keeps focusing on as an opportunity that society
Correct.
Needs that focus. But then you hit on nutrition, and so I want to talk about that for a second. We also know that sort of focusing on physical activity only goes so far, right? So physical therapists do that. What's the role for physical therapists in that nutrition space? What guidance can physical therapists provide, and value can they provide there?
Well, I think they can at least instruct the individual on what the guidelines are for a healthy diet in terms of the amounts of fruits and the amounts of vegetables and the decreasing of the saturated fats and more of either the mono or the unsaturated fats. If there's a major problem in weight control, as there is with the obesity overweight, which is also very prevalent in this population, there's lots of sources that we can refer to, whether it's nutritionists or dietitians or others with whom we should be practicing collaboratively.
So what do you hope, for anybody that attends the session, what do you hope they walk away really understanding?
I just hope they come up with a different frame of how they look at an individual when they come into their practice, whether it's in the hospital or the clinic or the private office or wherever it is. You've got to think of that whole person. It means that you've got to check their blood pressure. You want to do their history to see if they're, again, a family history of diabetes or heart disease. If we see numbers of patients with chronic obstructive pulmonary disease, we know that we need to get them earlier. And the more intense the activity we can do with them, the better they do. So it's that kind of orientation that I hope they'll come away with tomorrow.
So again, that's tomorrow. It's from 1 to 2:30 for people who are here in Boston. I can't let you go without sort of, when you're in Marilyn Moffat's company, you have to ask her appropriate questions. Next is a place that, we have our signature lectures, our McMillan lecture, our Maley lecture. It's a place people come to get inspired. In your career, when you look back on the people who inspired you or the lectures that inspired you, what stands out?
Oh, there's so many. I would really hate to single out one.
No, just pick one at random.
Because I've been in this profession for so many years.
It's been 20 years.
Yeah, 20, right. I wish. But I'm happy I've lived through multiple generations. I had the good fortune of seeing so many of our early leaders in my early lifetime career. I mean, the Charles Magistros, the Robert Bartletts, Margaret Moore, and I even knew Mildred Elson, who wound up being president of WCPT. Each and every one of those had an impact in my life in some way or another. And I just thank my lucky stars that each of them imparted to me an incredible love of this profession and this association.
So from all that, is there, if you're big on mentorship, you mentor young people.
I do.
Is there one, for a student who's coming into the profession today, is there one thing they should be focused on or one sort of lesson that you give them to prepare them?
Well, I try to get our students involved as early as possible. I know that all of our students who have either gone to student conclave or combined sections meeting or to next come away with a whole different orientation of what the profession is like. And I think I certainly got bitten by the bug when I attended my first meeting. So I sort of hope that that's what I can impart to students.
She got bitten by the bug and she's still here. She's Marilyn Moffat. I'm Jason Bellamy, and we'll come to you in just a little bit with more broadcasts from Next 2017 in Boston.